Today we are here with Professor Ivo Boskoski, an expert in advanced ERCP, and we're going to discuss how advanced technologies in the field of endoscopy can improve patient care and safety. Can you give an example of a case where a slim duodenoscope can improve the safety and efficiency of the procedure?
Well, first of all, this duodenoscope brought us back to the future. So why? Because in the past we had this kind of a duodenoscope. It was very fragile and was not so user-friendly. Now PENTAX gave us the solution with this 10.8 millimeter duodenoscope that easily passes strictures of the duodenum, pylorus and antrum. This is really a nightmare for the endoscopist doing an ERCP. You go down and you see the stricture. In most of the cases it is asymptomatic, the patient is not vomiting or has some discomfort. And then with a normal duodenoscope it's impossible to pass. So with this tool, with few maneuvers, you're in front of the papilla. Either it's benign or malignant. In most of the cases it is malignant. For benign you can also dilate with the risk of perforation and to pass with a normal duodenoscope. But this is really the best solution in these cases. And of course, being a smaller outer diameter and the inner channel is smaller, and this is the only drawback, so we cannot use accessories that are big in diameter, but we can do most of the cases that are operative, and we have a very good solution now for the patients.
Would you say that patient discomfort is also improved by using a slimmer duodenoscope?
Well, some patients after using a normal diameter duodenoscope can have pain in the throat. So with the small diameter duodenoscope, it's almost like a gastroscope, because unless you do something traumatic to the duodenum and the stomach, it's really painless.
How does the PENTAX Medical disposable elevator cap, the I-DEC, help to improve the safety profile of ERCP procedures?
Well, there have been infections with the duodenoscopes because the elevator is difficult to clean. Of course, correct reprosexing of endoscopes is mandatory. But however, when you go back to the duodenoscopes, this brings the bar very high in quality. It works perfectly, it's disposable. You need to, of course, know how to place it on correctly. And it's a really good solution for patient safety. So this impacts a lot.
Professor Boskoski, thank you so much for sharing your time today with us and answering our questions.
Thank you.